Good morning, everybody. I'm George Isham. I'm the chair of the Institute of Medicine Roundtable on Health Literacy. And it's a pleasure to be here in sunny Southern California, although it's not quite so sunny this morning. I would like to take this opportunity to welcome everyone to today's workshop on the implications of health literacy for public health. Looking over the materials ahead of time, I'm very excited to anticipate the good conversation we're going to have about the relationship of health literacy and public health. I want to let everybody know that this meeting is being recorded and videotaped, and we are being watched, hopefully by thousands on the webcast. That will allow us to not only have the experience of this conversation shared with a great number of people around the country, but it'll also allow us to archive it and have it shared over time, hopefully with a number of people as well. So that's a really terrific advantage to the webcast feature that we have. We are extremely pleased, and I am extremely pleased, to convene this meeting to discuss ways in which health literacy can facilitate the important work of public health agencies. The Roundtable on Health Literacy focuses on building partnerships to move forward the field of health literacy, and as one of our major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and concern. So it is our hope that this workshop will serve to expand the network of those involved in health literacy innovations and problem solving. We also hope the meeting will foster additional dialogue among existing organizations and individuals about the importance of and the possibilities for health literacy efforts at many levels. So in terms of that dialogue, we have asked a number of people to be with us and make presentations today. But those of us who are here to listen and then participate in the conversation have a critical role to play in making sure that this dialogue is effective in achieving our overall purpose. So I'm going to ask each roundtable member, as I have customarily done in previous roundtables, to be making notes throughout the day as you listen and during the discussion periods. I want you to note the key ideas and concepts that are brought out in the presentations and the discussions. And in the discussion periods, as well as at the end of the day in particular, I will go around and ask each of the roundtable members to identify and describe those key insights. That's an important step in these dialogues because it allows us, when we produce a summary of this workshop, which we will do, to record your thoughts that are stimulated by what we're about to hear from those of us who've come to make presentations. And that makes a better summary and a better dialogue to stimulate people who then read those summaries and use them further to stimulate their own thinking. So it's not only those who are making the presentations that have work to do, it's each one of you in the audience that also has work to do. I will, after I focus on the roundtable members, the members of roundtables who are sitting down in the front here, and time permitting, give the opportunity to those members of the public who are here today to also make observations, but that will be time permitting. This workshop was organized by a planning committee, and I'd like to extend our thanks to the members of that committee: Olivia Carter-Pocris, Jennifer DeLahaye, Patrick McGarry, Andrew Pleasant, Lindsay Robinson, Rima Rudd, and Steve Rush. I think they put together an excellent discussion for us today. So we're going to begin today with a presentation that provides an overview of health literacy and public health. From there, we will move to a presentation on reframing health literacy as a public health issue, and then on to the presentation of a commission paper. So I want you to hold your questions until all three of the presentations have been completed, and then we'll have our discussion period. It is important for the presenters, and I'm looking at the presenters now, to keep on target and on track. And I've asked Roundtable staff member Melissa French, who's sitting right there. Melissa, wave your hand. Those of you who are speakers, see where she is. And if I'm standing here where you may be standing when you talk, it'll be easy for your eyes to wander over to Melissa and see her. So I hope you'll heed her efforts to keep you on track. She'll be giving you a 5-minute warning, a 2-minute warning, and then your time is up and you better stop talking warning. Okay, terrific. So now at this point, I'd like to introduce our first 3 speakers. These will be very brief introductions, but you have their full biographies in the meeting materials. And so please see those materials. If you don't have them with you, they are also available at the registration desk. Dr. Rima Rudd, who's been really important to our conversations over the years and is still important in this field, is the senior lecturer on health literacy, education, and policy at Harvard School of Public Health. She has focused her research, inquiries, and policy work on literacy-related disparities and literacy-related barriers to health programs, services, and care, working closely with the adult education, public health, oral health, and medical sectors. And whenever I introduce Rima, I always have to note that Rima is the one that I first learned about health literacy from, and I'm grateful to this day for that. Thank you, Rima. Our second speaker is Dr. Chloe Bird, who is senior sociologist at RAND Corporation. She is principal investigator of a study of the impact of neighborhoods and behaviors of allostatic load and morbidity, on a study funded by the National Heart, Lung, and Blood Institute of neighborhood effects on incident cardiovascular disease among women based on data from the Women's Health Initiative. And so I look forward to learning much more about that. And our third speaker is Dr. Andrew Pleasant. He's Senior Director for Health Literacy and Research at the Canyon Ranch Institute, where he's responsible for advancing the role of health literacy across Canyon Ranch Institute activities, including in current partnerships and programs, as well as in planning future activities. And I certainly enjoyed reading the paper that you and your colleagues put together, and look forward to that discussion, Andrew. So with that, and without further ado, I'll turn the discussion over to Rima.